Right now, the Young Nurses Indaba trade union says it's endured enough with the mountain of challenges facing the healthcare sector. Members affiliated to the union today resolved to embark on a march to the Gauteng Health Department. And our reporter Lindo Kulu is on the ground and he joins us now live to tell us a bit more. Lindo, just very quickly, earlier on you've been with the healthcare workers. They're complaining about the same things that they've been complaining about for a number of years now. Has the Health Department responded to their memorandum today?
Well, the response from the Health Department, as they've just handed over their memorandum of demands just a few minutes ago, was to say that they'll be taking this memorandum to, in fact, the MEC so that she can have a look at it and actually consider it. But essentially today was another day of demonstration for the young nurses here, the Young Nurses Indaba Trade Union, essentially saying that they are against the sacking of about half of the 8,500 workers that were hired during the height of COVID-19. What they are saying, in fact, is that they want to see them absorbed. They're saying that they cannot be hailed as heroes one day and then the next day they are discarded like that. So they were demanding, first and foremost, that they be hired. But this was not just a march from one union. It was other unions that had joined, including unions from those that are cleaners, those that are securities within the Health Department, but essentially calling for permanent employment, saying that they've been used for years and now they want to see the Health Department do something about employment. But at the most, it is the demand for employment. But perhaps take a listen to the General Secretary of this particular, the Young Nurses Indaba Trade Union, just giving us a sense of what it is that they were marching for today.
The march is about protecting the jobs of those people we all called heroes during COVID. These people, they abandoned their own families to take care of South Africa. Today, the very South African government, the Department of Health particularly, that sent them as heroes, cannot find a space to absorb them. Yes, they know we are struggling with serious shortage. They know that our hospitals are barely surviving. They know that we cannot cope at all when it comes to delivering quality health care. So we are going there and saying those who are additional staff for COVID must be absorbed in the system, EPWPs must be absorbed in the system, community service nurses must be absorbed in the system, and security must stop being month-on-month contracts, and that's that.
So, Linda, this was obviously sparked by that protest we saw at the Chris Hani Baragwanath Hospital in Soweto last week. Give us a bit of context as to those 850 workers who are now facing no employment after the 31st of this month.
Well, in response to the COVID-19 pandemic, Masego, government had resorted to giving a grant to the Health Department. This is on a national level where they hired about 8,500 nurses as well as health staff to continue to try and alleviate pressures when it comes to COVID-19. Now, what has happened is that as we are nearing the end of the financial year, that grant has lapsed, and what they are saying is that they received an additional grant, not as much as the 2.5 billion from the last time. This time around, they've received 1.1 billion to actually ensure that they continue hiring some of these workers. But essentially, what this means is that half of those 8,500 workers will now be without a job. And this is why we're seeing many unions taking to the streets and taking to the Department of Health to say that this cannot be accepted. So essentially, the Department of Health in Gauteng held a press briefing last week after those protests we saw at the Baragwanath Hospital. What they were telling us was that they simply do not have enough money in their coffers to actually absorb some of these staff. But the arguments from unions as well as workers is to say that the Health Department was already understaffed, it was already under pressure even before COVID-19, and they do not understand, they cannot comprehend why is it that today some of those workers that were brought in during COVID-19 to fight against the pandemic are now going to go jobless. So that is essentially two butting heads of this particular argument. The Health Department today, in trying to get a response from them about some of these growing concerns from the workers, told us that essentially their stance is the same. They do not have the money. They can only use what they've been given, 1.1 billion, but that would only mean hiring only half of the 8,500 workers nationally that had been roped in during COVID-19.
All right, Lindo Kutlekulu in the city of Johannesburg for us, outside the offices of the Health Department. Let's leave it there for now.